Welcome back. In this video, we are going to learn about very important topic, Horner syndrome. No topic is less important. Every topic is important, but this topic, if you are going to the competitive exam or tomorrow for the board exam, and you want to make a big list of important topics, and this is among the 10 topics, top 10 topics you have to keep from OPHTHAL. Yeah, okay. So, Horner syndrome. What is the another name for Horner syndrome? It is also called as KS, means another name. Okay, the in previous video someone was asking what is KS. It is called also called as, okay, oculo sympathetic palsy. Very important topic. Concentrate. Okay, write a proper notes so that you won't miss out any points. I'll be giving the minimum content which you have to learn for this topic, so that you know my regular dialogue. Learn the minimum content so that you can fill the paper well. Okay. Features. What happens like hypothalamic nucleus. Make this pathway so that you won't get confused about this pathway. Even this is important for first years, like in your anatomy. Okay, CA to T1 junction. Then we have passes between clavicle and tip of lung. Clavicle and tip of lung. Then it goes to inferior cervical ganglion. So there is something inferior. Then we have superior cervical ganglion. Then what happens? It loops around which artery? Loops around MCQ which artery? Internal carotid artery. चिपक जाएगा. That's it. Then loops around. After looping, it got bored, so it enters into middle cranial fossa. But how? Through carotid canal. It just used internal carotid artery to achieve its further achievement. Then after that it enters orbit. Then eyeball, which is nothing but orbit. Then what happens? It supply dilator pupil. Okay, this is the what we say sympathetic nerve supply for the pupil. Okay, we will revise this quickly at the end. Okay, if you are still having confusion, read it twice or thrice so that you won't forget the topic. Then, so what are the causes? We'll discuss important causes, some 2 causes. That's it. First one, Pankos tumor. Where this will be seen? This will be seen, yeah, Pankos tumor occurs at lung, at this site. Pankos tumor. Mark it with a different color or some however you want, like which color or something. Just right there, circling that lung, Pankos tumor. Okay, then what else? Most common in adults, congenital Horner syndrome. ये क्या हो रहा भाई? कंजेनेटल बच्चे तब थे, तब भी डायग्नोस नहीं हुआ, बड़े होके वो दिख रहा है. क्या हो रहा है? थोड़ा तो कुछ हो रहा है. Just remember, congenital will be most common cause in adults. That's it. So we see shoulder dystocia. Yeah, comment me that, let me know that which now causes shoulder dystocia, which damage, what kind of structure damage in brachial plexus causes shoulder dystocia. Then during normal vaginal delivery, disproportionate size of, this is a OBG topic. If we'll discuss this topic in detail in uh, delivery part of the labor part of the OBG section, obstetric, so that you won't get confused, it will be clear. So what happens, there is a fracture of that hashtag symbol is like, for juniors I am saying, it defines fracture during delivery. Not during delivery, fracture happens, like it's a common fracture. Okay, so what happens, damage to sympathetic fibers. Okay, that was a small concise pathway. Then coming to clinical features, important, don't skip this part. Okay, end of thalamus, is it real? No. It's a pseudo, we call it as sucked in eyes. Then we have ptosis. Yeah, we discussed this topic in our ptosis video. Okay, you can watch that video for detailed review. Then we have Muller's muscle supplied by pathetic nervous fibers, where partial ptosis of eyelid is seen. Okay, after this video, if you have not watched my ptosis video, it's not a promo for that video, you can go and watch if you are interested. Okay, so that you will understand better. Then we have anatrosis. What is the meaning of this? Is loss of sweating. Yeah, first you need to learn the terminologies of the every subject so that you won't get confused. Yeah, when I was in third year, it was very difficult for me to understand because I skipped the basics video. Okay, don't make that mistake. Meiosis, fibers which supply like dilator pupillae would not act. Basically, they are not acting. Function of the sympathetic fibers, yeah, let me know in the comment section. Okay, congenital Horner syndrome helps in what it do, distribution of melanosomes in where, iris, yeah, color structures. Okay, what happens, so there is some problem with the color, so heterochromia in iris. What happens, iris will not acquire pigmentation, so that beautiful black eyes, when you're going to propose a girl, you'll say that beautiful black color eyes, not black eyes. Yeah, then we will learn about treatment. So there is no specific treatment for this, like we can treat with the one type of mode or like that. So you have to treat the underlying cause. When it comes to Pancoast, you have to the patient has to undergo surgery. That's it. Yeah, let's revise quickly. Let's make it bigger. Yeah. So today in this video we learned about Horner syndrome. It is also called as oculosympathetic palsy. So features, nothing but your pathogenesis. Hypothalamic nuclei, C8T1 junction. At that, it passes through that C8T1 junction, and then it passes between the clavicle and tip of the tip of the lung, where you'll see the at the lung, tip of the lung, you see Pankos tumor. Then it passes to inferior cervical ganglion. Then if there is a inferior, then there is a superior, right? Superior cervical ganglion. Then important, it's a love, it's a pair, internal carotid artery, it loops around, and then later we realize that it just used to reach its destination, enters in the middle cranial fossa through carotid canal, then orbit, then eyeball, then and finally it reached its destination to supply pupil. Then what are the causes? We saw Pankos tumor. Then most common cause, congenital Horner syndrome. We saw clavicle fracture, which leads to shoulder dystocia. Yeah, use the comment section. Which, yeah, let me give the hint. It is related to brachial plexus. Brachial plexus. Yeah, we'll discuss this in the OBG portion, this vaginal delivery part detailedly, and this brachial plexus in anatomy section, right? Then what happens? At last there is a damage to sympathetic fiber, and if we see some damage, then there will be some consequences. So what are the consequences? End of thalmus. End of thalmus, how it will be? Pseudo. Okay, don't forget. Ptosis, check out my video, don't forget. Then anhidrosis, meiosis, congenital Horner syndrome, where heterochromia in iris, that peri आंखें without color, black and white हो जाएगा, right? Then treat the underlying cause. For Pankos tumor, we do surgery. Okay, subscribe, don't forget to subscribe. Yeah, we really appreciate if you subscribe. If you subscribe, you'll see the further good videos if you feel I'm good. Yeah, thank you.